Thank you all for joining us for this webinar. In this program, we're looking at working from home and managing your MS symptoms, particularly in relation to the COVID-19 experience that we're all going through now. Jackie Efthimiou is one of the employment support consultants, and she's online as our presenter tonight. And I'm Andrea Salmon, one of the education program coordinators, and I'll be facilitating tonight's webinar. We start all our programs by acknowledging and paying respect to the traditional custodians, past, present and emerging, on whose lands we're all meeting today. We acknowledge the deep feelings of attachment and the relationship of Aboriginal people to country, and we respect the cultural authority of the elders in each community. It is my pleasure to have Jackie online tonight. Jackie is one of our occupational therapists who works with the Employment Support Service. Jackie's based in Sydney, and actually I'm not sure now, Jackie, how long you've been with us, but the time is probably slipping into many months.
I'm coming up to my 1-year anniversary, actually.
That's fantastic.
So thanks, Andrea, for that introduction. And the last time I did a webinar, halfway through, someone told me that my microphone was too close to my cheek. So please, if there's any issues with sound, put a note through to the chat and Andrea can let me know so that we're making sure that everyone can actually hear me. So thanks for coming along tonight. As Andrea said, it's about working and MS, managing symptoms, but particularly looking at what's happening in the current situation with COVID-19. So what we're going to look at today is up on your screen now. So that some of the benefits of work, the barriers to work, managing your symptoms, how to set up a home office, what to look for, what to have a think about when you're looking at disclosing your MS diagnosis with your employer, some of your rights and responsibilities in the workplace, particularly looking at COVID-19 and what you could be asked to do and what options are out there for you. And leading into what Andrea was just saying with the follow-up next week is what happens next. So looking at your options with the law, so legal aspects as well. So that's the little plan that I've got put together for today's session. So benefits and barriers to working, and I'm sure we can all think of many benefits to working, and it's not only the financial aspects, but there are social benefits, the physical benefit of getting out and about into the community. And a lot of us use our occupation to actually define part of our identity, which is really important for a lot of people. There is also some really strong research out there that working can actually have a protective benefit for people with MS and can delay the disease progress. Now, in terms of barriers, this is a question I want to put out to people that are actually listening in today. What do you see as the barrier to you continuing your particular work? So I want you to take a couple of minutes just to write something in that chat box and send it through to Andrea, and we can go through those a bit later in the program as well.
Do you want those now, Jacqueline, or do you want them later?
I'll probably do them in a couple of slides.
Cool.
I'll come back to you.
Yep, that's lovely.
I'll get you working hard, Andrea. All right, so looking at MS in the workforce, the majority of people with MS already have established careers at the time of their diagnosis. So given that most people get a diagnosis between the ages of 20 to 40, that's the biggest time in our lives where work is probably a priority for us. The way to manage work is by managing your symptoms well and keeping yourself as well as possible. There are lots of symptoms that MS can bring about, and symptoms vary from person to person. So considering the symptoms you actually experience, but not every symptom is going to impact your work. So some symptoms might just be there. Some symptoms will definitely impact work, and those are the ones that we want to look at how they can be managed. So some symptoms that we look at with our clients are fatigue, cognitive function, mobility, visual changes, bladder and bowel changes, heat sensitivity, and depression or mental health. So looking at a few ways that these can be managed, looking at fatigue, you can start by really looking at what causes your fatigue and a discussion around fatigue management strategies to help change those patterns. Looking at work structures, can you change your hours, your days, the number of rest breaks you have? Could you work from home or find a spot in the office to rest for 15 minutes during the workday? Changing structures may involve meeting with your employer. It's probably not something you can just decide on your own and go forward with. Looking at a workstation assessment to look at alternative options for supportive seating, and sometimes that helps to alleviate fatigue as well. Managing changes in cognition is a lot harder, but prioritising activities and ticking them off when they're complete, using a diary. I always have to use my diary, so I'm not relying just on memory. Advising other staff that you can only do one task or listen to one person at a time so that they're aware of what your difficulties are. Looking at assistive technology such as different applications that can now transfer talk to text so that they can take minutes during meetings so that you can actually concentrate on what's being said during a meeting rather than trying to shift your attention between listening and taking notes. When we're looking at the impact of heat, we could use cooling garments such as a cooling vest or a necktie. Other strategies are keeping well hydrated, using air conditioning or mini fans as well. I've got a lot of clients who use those in the office. To help with mobility, we're reviewing options of assistive technology to make sure you're maintaining your balance. Looking at a worksite visit to review accessibility and making suggestions about how you can manage the impact of your mobility. Reviewing options to apply for a disabled parking permit, mobility allowance, and I'll go a bit further into those later on today. And maybe even looking if there's an option for a physio assessment to really increase strength and stretching exercises. In terms of vision issues, you could look at equipment options such as a larger screen or a low flicker rate on a computer monitor, different keyboards or different software options. And around the depression or mood issue, looking at what counselling and psychology services that might be available to you, looking at mindfulness, meditation, relaxation. And a lot of people forget that when you are employed, you should have access to an employee assistive program and an EAP, which allows you to access counselling services that are free and confidential through your work. So a lot of people forget that those exist, but they're very useful to tap into as well. So Andrew, I might throw back to you about the barriers that people have put up.
Absolutely. And I thank everyone for what they've contributed so far. So we go from some quite simple responses that are simple but complex because a few people have said fatigue.
Okay.
You know, fatigue is the biggest issue.
Yep,
then
absolutely.
Someone's indicated pain.
Mm-hmm.
We've got a comment there too around it's not only managing fatigue, but it's the huge workload that's expected from us.
Yep, so the expectations of the workplace, yep.
Then we've got not only fatigue, but competing demands and a bit of cognitive slowing.
Mm-hmm.
And then someone's even embellished that more, which is fantastic because the comment's been made that when your job relies heavily on time management and managing priorities, and you've perhaps noticed some change with your memory or concentration, there come mistakes. And then when those mistakes come, there's the feeling of frustration. And even though the rest of the team might know that you've got MS, it's no less frustrating and sometimes even embarrassing. That can then cause other problems to redevelop like migraines, and I'm going to add probably by stress and then your coping mechanisms drop away even further.
Mm.
Then we've had the comment about having to meet the physical requirements. That can be really challenging as well.
Yep, yep. So all of those are very common barriers that we come up against with all of our clients that we're working with in the employment support service. And every single one of those barriers can be managed to a certain degree depending on the support that you have from your employer as well. So those particular ones that you've listed, mainly fatigue, cognition, those time management, prioritization tasks are definitely things that we have come across with lots of our clients, and we've got a lot of ideas around how we can support people with those as well. So I'll keep going, and I'll let you know how you can get in contact with us at the end too, if we can be of support further. Okay. So everyone with MS experiences different symptoms, and even just that small outline of the barriers indicates that as well. And the symptoms you experience will have a lesser or greater effect on your job depending on the type of work you do. So if we think about what's involved in our job, it'll be different for everyone, but that's our job description. So those inherent requirements are the essential activities of the job, the core duties that must be carried out in order to fulfill the purpose of the position. But even with those inherent requirements, there's still additional aspects of each job that are peripheral or non-essential tasks, and those aspects may be more negotiable or flexible in the workplace. So being aware of what your job description actually is allows you then to basically negotiate with your manager if there's areas that you can drop out of or change or manipulate as well. So an example of an inherent requirement is a train driver must have the physical capacity to sit and drive a train, but also the cognitive capacity to know how to work all of the buttons. A waitress has to have the physical capacity to be on their feet for a long period of time, but also have the ability to listen to what someone is saying to them and write down their order. So we always need to consider what roles we've taken on that may not be part of our job description, and those could possibly be revisited as well. Okay, so like many of us with COVID-19, what if you suddenly find yourself working from home? Well, looking at this guy sitting around like this is not the best way to do it, but unfortunately, it is something that we see a lot of in this period of time. This posture may lead to increased risk of injury and would likely increase fatigue levels. So what can we do? We need to make sure that we have the best setup that we can to minimize the strain on our muscles. We want the equipment to work for us, not the other way around. So as you can see here, sitting bent over the laptop places a lot of strain on our neck and upper back. We need to ensure that our monitor is raised up high, that our feet are supported, our elbows are level with the desk, and our eyes are looking comfortably ahead. So on the next slide is a really good handout that I use for a lot of my clients, and I actually get them to print it out and stick it on the wall if they are working at a desk with a computer in their role. We just use it as a reminder to have that upright posture. The more upright and the more relaxed we are at the same time, the less fatigued we're going to get overall. So what equipment do you actually need to set yourself up well? So you need a chair, which is always good, with an adjustable backrest or a lumbar support, and a monitor, particularly an external monitor if you're working straight from a laptop, an external mouse and keyboard if you are using a laptop, and then raising the laptop on a sturdy item, a footrest if your feet don't actually reach the ground. Now, this photo is actually my manager's setup at the moment because he doesn't have an external monitor at home, so he's had to raise the laptop to get it at the right level for his vision. but he's using an external keyboard and mouse so that he's not having to use the laptop keyboard directly. So be creative, and if you need to use household items, then you can do that as long as they're safe to use and the whole thing's not going to fall over backwards and break. But it's important to remember that even if you're not working from home or don't work in a traditional office, there are ways to adapt your working positions and postures to improve your overall posture and the way you use your body in your role. So an example of this is a dental hygienist that I work with at the moment, and she was finding it hard to sit for long periods of time and clean people's teeth. So we made her role actually modify in terms of the amount of patients she saw. So she would see a patient and do a 30-minute check-up with them, and then for the next 30 minutes she would be in the sterilisation room in a standing posture doing sterilisation tasks. So she'd be changing between those two postures. Another example is I've got a registered nurse who works up at one of the hospitals, and throughout her day she needs to sit and actually take some time out. So instead of being on her feet the whole time, she goes and sees a client, maybe takes their notes with them, sits down, writes some notes, and then keeps carrying on. So you don't have to work at a traditional computer setup to really think about how you can change your working postures and positions while you're doing your duties as well. So in the COVID situation, wanted to put this one in, which is how to not only survive, because it feels like we're all just getting through it, but how to thrive. So there's some things that came up when we were looking at this working from home or this change in our normal pattern of working. So the first thing is to try to stick to a schedule and maintain that routine. So starting and finishing work at the same time each day as if you were at the office, trying to separate work time and personal time, because it'll make it easier to detach both emotionally and physically at the end of the day. Trying to develop some daily rituals before you start work and when you finish. So we might have done that in our commute to work. So my commute to work is my getting ready to process work. So listening to the radio, working myself up, and then I'm in the office. My commute home is my wind down, where I'm thinking about the day and I'm putting all of that into the back of my head so that when I get home, work is not on my mind and I'm moving into my home life. So something like doing a short walk before and after you start work, just to mentally distance yourself from work as well. And making sure that you leave your workspace during the day. It's really easy to get caught up in things and sit at your desk and eat lunch at your desk, but try and actually get yourself up, go out into fresh air, get some sun, and do something else that takes you away from work, reading a book, watching a video, listening to a podcast, or doing something mentally stimulating like a crossword. I also like to even do meditation during lunch if I've had a particularly hard morning doing some work. Giving yourself space. Not easy when you've got 2 children at home also homeschooling while I'm trying to work from home. But if you don't have a dedicated office that you can shut the door in, try and corner off your workspace. I actually pack my workspace up at the end of the day so that it's away from everything else, and then I'm not enticed to go back and check my emails before I go to bed. So trying to have it separately. Physically close things down and tidy up your space as the last thing you do before finishing work. Something that you would normally do as a ritual at work. You would shut your laptop, you'd close everything down, pack your bag and leave the office. So trying to keep that space going as well. Trying not to let your usual practices go. And I know one of the great benefits of working from home is wearing comfy clothes. I'm sitting here in a pair of track pants and a really warm jumper, which is awesome, but maybe don't go in your pajamas all day. It's important to keep doing those things that you used to do, like making your bed in the morning, washing your breakfast dishes, getting dressed, brushing your hair. Not only does it make you feel better and more prepared, it actually maintains that professional sense of self. And if you are going into video meetings or Zoom or anything like that, Remember to check yourself out in the mirror before you go onto Zoom. Like I made the tragic mistake last week when I was ready to go onto a Zoom and looked at my hair and went, oh Lord, I need to go and brush my hair. Building boundaries. So it's really easy to keep going when you don't have to commute to and from work. It's very easy to extend your hours during the day because you're being flexible. But really important to make sure that your boundaries stay in place. So I've got a client who works for a very high-end company in a HR department, and at the moment he's struggling because he's trying to do 14 hours in a day. So really making sure that you're cutting back, that you're starting when you're supposed to start and finishing when you're supposed to finish, and making sure that the rest of the team is doing the same thing as well. It's not just for you, it's for everyone too. Staying connected is a really hard thing. So working hard to keep those connections with your team members, your manager, your clients. It's really easy to become a hermit, especially if you're more introverted. So trying to have virtual morning tea or afternoon tea, just regular catch up ideas with colleagues or friends as well. So these ideas are just as important if you're also trying to manage homeschooling whilst working from home. We do have quite a lot of clients that we talk to about how they're juggling that at the moment. Okay, so going into your legal rights, and I guess Andrea was saying that there's another session scheduled next week, so she can come back in and remind you about that at the end. So if you do have questions of a legal nature, then you can come into that session and actually ask them as well. I'm just going to skim over these three main ones, which is discrimination. So obviously there are state and federal laws which aim to protect the rights of a person with a disability. So it generally prohibits employers from dismissing or disadvantaging their employees because of their disability. So just keeping that in mind as well. Privacy and confidentiality. Whatever information you disclose to your manager should stay confidential with your manager unless you give them permission to share that with anyone else within your team. Reasonable adjustments. Now, this is what we really look at within our employment service support, is what adjustments can be made to your role to allow you to continue to work in it with your disability in mind. So the legislation doesn't specify the types of adjustments required, but it allows us to request reasonable adjustments or work-related adjustments to allow you to work in your role. And that might be reduced work hours. It could be a different start and finish time to work around your levels of fatigue. It could be different equipment options at the workplace that supports you particularly to manage fatigue or pain or your seating posture, those sorts of things. So they're all reasonable adjustments. Okay, there's loads of information at the fairwork.gov.au website, and those lawyers there, Birrell and Watson, are the ones that are actually going to be presenting that next session coming up as well. They're kind of our go-to gurus of law and discrimination because they've been working in it for such a long time. They know it inside and out. So if I had any questions, I would go straight to them. So what are you entitled to? Exacerbations can be really unpredictable in MS, but knowing how much sick leave, annual leave, long service leave you have, it actually helps you to plan. So making sure you're actually using your sick leave when you are unwell. If there's any doubt, you can always go and get a medical certificate from your GP. It can also be useful to ensure that you're aware of your organisation's policies in relation to sick leave, unpaid leave. What does your award and contract actually indicate? So when I worked at one of the big public hospitals, our requirement for sick leave is we had to have a medical certificate if it was a day before or after a weekend, particularly if it was a long weekend. So knowing that those policies and procedures are in place makes it that you can actually plan leave ahead. You might have a flexible arrangement or taking purchase leave as well. So there may be other options that you're entitled to. There may be some entitlement to sickness benefits through Centrelink if all your leave has been exhausted and extended leave is required, so there's a sickness allowance. The next step would be looking into if you have a salary continuance or income protection through your insurance or superannuation policy. What benefits do those allow you? So there are different thresholds and percentages involved with those payments, so you'd have to look through those on a case-by-case basis. Another aspect you can go to is your union if you're a member, and if you have any concerns regarding your issues, it can be really useful to contact them for advice too. So there are loads of entitlements out there. Which ones could you be eligible for with a disability of MS? So the biggest one that we definitely get our clients to apply for is the mobility allowance. It's basically for anyone with a disability who cannot use public transport without assistance. So that means that you get a funded fortnightly payment into your bank account that you can then use for taxis, Ubers, or any way for getting to and from places in terms of doing work. So the other one is sickness allowance. So if you're having to return to a job after a short-term illness or ill health, it is means tested. There's a disability support benefit. There's the essential medical equipment payment, which is an annual payment to people who use increased energy costs because of essential medical equipment. There's carer allowance if you do have a carer as well. Now, the NDIS is the National Insurance Scheme designed to empower people with disabilities. So you may know someone that already has NDIS plans or NDIS supports. Applying to the NDIS is a whole journey in itself. So that would take up my entire hour if I was to talk about that tonight. But there are certainly supports through MS Connect. We have an MS engagement team that supports people in that journey and getting into the NDIS as well. There's a mental health care plan, which looks at providing subsidised access to psychology or psychiatry for counselling purposes. There's also allied health visits where you can get 5 subsidised visits per calendar year, and they're all through access through your GP as well. The medical cooling concession can provide some rebate on how much you spend during the summer period in terms of regulating temperature. So if you're using the air conditioner a lot more to regulate your temperature due to your MS, you can actually get a rebate there from November to April each year. The disability parking permit is quite easy to get in touch with, and I find that people say, oh, but you know, that's really broadening the system. I can walk, but I always tell my clients to think of themselves on their worst day. On their worst day, if they had to go to a neurologist appointment where the only parking out the front is a disabled parking, would you prefer to take it or walk for an hour? And that usually gets my clients going, yes, I could use it. And most of the time I say to my clients, if you don't need it, just put it in your glove box. You don't actually need to display it at all times. So they're just some different entitlements that we help our clients get access to or provide more information to as well. Okay, disclosure, really big discussions around disclosure. So I'm not going to look at the legal perspective, I'm going to look at the practical side. So when looking at disclosing your MS diagnosis to your employer, you need to consider who, when, and what you're actually going to say. So where symptoms actually impact the safety of your role, there is a legal obligation to disclose. So there's an OH&S risk if you're an electrician that's working on a high-rise building and you could possibly have a seizure. That is a legal obligation to disclose that condition to your employer. Now, you do need to consider if it's in your best interest to disclose. There are, look, I'd say 95% of the employers that I've worked with are very supportive. But if you're working for that 5%, you may want to consider whether or not it's in your best interest to disclose. So consider whether you'd actually be more supported if your employer was aware and able to assist. But still, there are many adjustments that can be made without needing to disclose your diagnosis as well. So jobs can be restructured, work schedules can be modified, or the environment can also be modified without having to tell your employer that you do have MS. Whether you do and how you choose to tell your employer is up to you, and it's a very personal decision and might depend on what you do, where you work, and your relationship with your employer as well. You might choose to have an informal chat, or you may make it more formal, possibly with the inclusion of a support person, and I've stood in on those meetings several times. You may have a member from HR, the union, or another colleague. You can also talk to MS Connect for help to prepare for that kind of meeting as well. So if you tell your employer, you may want to write down what you discussed and send it to them afterwards, and that way you've actually recorded you've recorded minutes of when you first told them about your MS, and if there are any things that were agreed upon in terms of keeping that information confidential, or sharing it with the team, or changing anything to do with your work. Okay, so that's a little bit about disclosure. So what if we've attempted to manage the symptoms and you're still struggling? There is no immediate reason to leave work unless your symptoms totally preclude you from doing your job. But even in that case, we would encourage you to speak to someone. I would encourage you to contact MS Connect in the first instance, or going through in terms of getting legal advice as well. It's really important to note that you should seek legal advice before reducing your hours and before leaving employment, because either of those options could actually affect any insurances or superannuation policies you have. So before I go into someone leaving their work, we look at what their superannuation levels cover, and most people do have either an insurance policy that we can access, a TPD that we can access, which is total partial disability. So before leaving work, you need to know what those entitlements are. So making sure that you have a chat with someone who can help you make those decisions as well. Now, what if we've taken all those steps? We're not ready to stop work, but we need to move on from the current role we're in. One thing that's really important to think about is what transferable skills we have. So often when we're at the crossroad, we feel that we need to go out and start doing all these courses and reskill and change careers. But we actually have a lot of transferable skills already. We all have these. These are skills that we've accumulated through our different life experiences, our jobs, our different roles, and we need to actually be exploring those a little bit more and using them if we want to try and remain, actually change roles as well. So they might be role-related, technical, or general skills that you could then use in a different capacity. So they're really important to consider before you go straight down the line of, oh, I need to go and do another degree in something else to change careers. Okay, work changes in COVID-19. These are just some examples of what an employer can request of you at this time. And these are based on what's been happening with my own clients. So they can request you to reduce your working hours on a temporary basis, work from home, then rather than going to the office, mix a work a mix of home hours and office hours. You may be stood down from work if there's no work to be completed, and that doesn't mean you lose your job. It's just that there's no work at this point in time. They might ask you to modify your work role within reason to enable you to continue working some hours, or take leave if you're able to do so. So what can you access if any of those things change? So there are new stimulus measures in place to support workers and business owners. So a lot of my clients who have dropped work and haven't been able to go into their jobs because the work has stopped have applied to Centrelink for the job seeker payment. And that payment is a fortnightly payment where you are not doing any hours due to COVID-19. The other option is a JobKeeper payment. Now, these are only eligible for companies that have a percentage loss that's indicated within the policy. So if your employer is telling you that they are going to apply for the JobKeeper payment, then they actually do that on your behalf. You will need to fill in a form and send that back to your employer, and they will access the keeper payment that will be sent to you per fortnight. Now, it seems that every 5 minutes I look at the MyGov or the Services Australia site and everything's changed. So obviously, don't take my word for everything. Go and actually have a look at the documentation that's on MyGov or contact Services Australia. That's the old Centrelink name. If you are contacting Services Australia, probably best not to do it via phone because you will have a long wait time, but try and do it online and send a question in and they will get back to you. If in doubt, give MS Connect a call as well and they can point you in the right direction or send you some information around that as well. Okay, so I might just open up to any specific questions, Andrea, and get the group on to see if there's any specific questions they have about the COVID-19 situation, and I'll keep going through and we'll revisit those.
Mm-hmm. Thanks, Jacqueline. A couple of comments that you might like to comment on. Louise is saying it's really hard to cut back on your hours. You know, the whole idea of balancing when the demands are put on you by your boss. So that's a really big issue for Louise.
Absolutely, and I think that's with a lot of my clients as well. So that's when it's really good to have a support person come in, set up a meeting and actually outline the expectations and the demands on a person and how that's impacting the work that you can get done. So there's a lot of times when I've gone in and set up a meeting with an employer and a client of my own where we nut out what hours are expected and what the work level is expected, and we maintain that as well. So documenting those things too. So it's really important to try and be as open as possible with your employer and really giving them a lot of feedback over the expectations. As I said, with my client who's trying to do 14 hours a day at the moment, his employer doesn't really care, quite frankly, because she works more hours than he does. So she kind of expects that, but he's not getting paid for those 14 hours. So it's about having those frank discussions and pushing back towards what those expectations are. The rest of his team is also not expected to work those long hours because he's been there for the longest. The expectation is that he does more work. So it's really about that to and fro with information between yourself and your employer to make sure that you're both on the same page. But it is really hard.
And I know too, over the years we've found that there are still some employers that are not supportive, but many employers are very supportive because they want to keep people that know their work in the job because that's a real benefit to them. So it's a worthwhile, even though it's a difficult conversation.
Yeah, absolutely.
Ask for some more details about the mobility allowance, and I know it has got a little bit confusing now that the NDIS has started. Correct me if I'm wrong, please, Jackie. My understanding is if you have an NDIS plan, you can build the mobility or the transport component into that. But if you don't have an NDIS plan, you can still apply for a mobility allowance if you can demonstrate the mobility limitations.
That's correct. So the mobility allowance is actually through Centrelink itself, Once you're on an NDIS plan, that mobility allowance doesn't exist anymore, and it changes to the transport allowance that's within your plan.
Yeah, cool. And Melanie's added a great idea, which I told her I would mention. If people are concerned, if they're getting a parking permit and they're concerned that they will be challenged, because it can be very hard to, like, you don't appear that you need the parking permit. The MSID card can be really useful, so that at least you can show that to someone that proves that you've got MS. It's, you know, it's not, it doesn't give you any other entitlements, but for that situation, it can be a really useful card to have.
Absolutely. Yep.
Sonia's made a comment about accessing your super at the moment due to COVID. Now, Sonia, I would absolutely say that before you do that, please come along to the session next week. It's actually not with John Beryl, it's with the lawyers from Maurice Blackburn, but that's okay.
Oh, Maurice Blackburn, yep.
Yeah. They all really know super. They really know our clients and are really supportive. You can access your super, but we probably want that to be a really last resort, because there are some very big downsides to doing that as well.
Yeah, there's quite a few fees involved as well with accessing your super early. So definitely something you want to discuss with someone in the know.
Yes, for sure. Rebecca's saying she's actually a bit nervous about face-to-face work again due to the COVID-19. But won't be able to work from home forever. And absolutely, Rebecca, actually in a couple of areas of my life, people are starting to say that they're a bit anxious about going back.
Yeah, and I have quite a few clients who are telling me the same as well. And I guess that's when you need to have those open discussions with your employer as to whether you can, you know, stay at home for a little bit longer to work from home until the bigger crisis is over. But you need to feel safe within your working environment. So a lot of my clients, I'm telling them to go back when they feel confident and when they feel safe to return, not just because the office is now open. Because with MS, your immunity is affected, so you're more at risk of developing an infection or picking up COVID-19. And it's not just at work, it's getting to and from work as well, which I think is the biggest concern, especially if you're using public transport.
Yeah, absolutely.
But I guess this situation has opened more doors for some of my clients in terms of that they have been able to demonstrate that they can do work from home and do it well. So a lot of my clients are actually saying, well, I'm going to go back and say I'm going to do 3 days from home from now on and go into the office twice a week, because this opportunity has demonstrated that we can actually do that.
Yep.
So it goes both ways, I think.
Absolutely. Yes.
Yeah.
Sonia's asking if someone who works full-time can access the NDIS.
Absolutely. The NDIS is not means tested. It is based on the functional impairment that your disability has on you. So I have lots of people that work full-time. I have lots of people that work in very high-profile positions that get paid a lot more than any of us probably do, and they have NDIS as well. So yes, absolutely, you can access that.
Yep. A couple of comments more about the mobility allowance. I'm actually going to let that sit. What I'll do is I'll get the fact sheet and I'll send everybody the fact sheet about the mobility allowance, because there's a bit of coming and going. It's getting a bit complex.
A bit complicated, yes.
Melanie's agreeing with you. Working from home has been so brilliant for her health and would prefer to work at home at least half the time.
Yep.
And maybe you can ask your neurologist, Karen, suggesting to write a letter of support for you to work from home. That's
absolutely.
Yeah.
So in terms of the registered nurse that I was talking about earlier, she's got a letter from her neurologist saying that she can still work as a registered nurse, but she should not be expected to nurse anyone with suspected or positive COVID-19 because she's more at risk.
Yeah. Just a comment about the being at risk. It's not a blanket that you're all more at risk because you have MS. Sometimes it's more related to what medication you're taking and whether that's having an impact on your immune system.
Level.
But yeah, and everybody will be different to that with that. And really, you probably are at a higher or in a higher risk category because you don't want to be getting COVID on top of living with MS as well.
Yeah, but no, you're right. It is to do with what medication you're receiving for your MS treatment and what your immune system is like at the moment. Yeah.
Yeah. Yeah. That's probably about it. There's a couple that I might respond to individually, and as I said, I've written myself a note to send everybody the mobility allowance. Yeah.
Fantastic. All right, so where can you go for more advice? So I've talked about MS Connect quite a bit. It's a brilliant place to start, and some really knowledgeable people that can give you advice over the phone. Your manager or supervisor, if you've got a good relationship with them, can point you in the right direction as well into how you can get support. Your HR department, so even if you want to ask anonymous questions through HR, give them a call and ask them about policies or what you can access. Your union, even if you're not a member, you can call them and ask for advice as well. The Fair Work Commission is there. There's superannuation fund advisors or lawyers. So as Andrew was saying, there's quite a few out there, and next week's going to have another space where you can ask questions and really look at where you can get some of that legal advice from as well. So just a bit about our MS Employment Support Service. So that's where I work. So we provide information, education and support to individuals. We look at people who are currently employed, and our aim is to maintain that employment, but we also help job seekers. So if you're between jobs and looking for a new job, then we can support you there. So there's a lot of things that we can do: assessment of your workplace, physical, cognitive assessments, assistance with managing symptoms, looking at modifications to your role or equipment, advice and assistance on really whole life issues impacting your employment, and really providing advocacy to a link to a lot of other services. So I've got an NDIS planning meeting with a client tomorrow. She's just been accepted to NDIS. So a lot of those things that we support with. We're basically in every metro region. So wherever you're based, you can access someone on the ESS team. What we require to register you for assistance at work: really basic information that you've got, confirmation of your MS, evidence of your employment, confirmation of your citizenship, a Centrelink reference number, and you must be working a minimum of 8 hours a week to actually get in to see our service as well. So NDIS, so the National Disability Insurance Scheme, you can access the employment service support and the NDIS at the same time. So just because you're on NDIS doesn't mean that you don't get to utilise our service as well. So basically from today, I want you to be as proactive as you can and really look at planning ahead. Knowing disclosure is your choice, but it may actually support you if your manager or supervisor knows what's going on behind the scenes. But again, it's your decision to make. Make sure that you're well informed before changing anything at work, because whatever decision you make could impact overall your income, your super, your tax benefits. So really seek advice before making any permanent changes, and being aware of what allowances and entitlements that you're also eligible for. Even though they're small amounts help overall. I think, to really manage those symptoms well. And MS Connect is basically the go-to, and we love them. They're really great. So I'm going to hand back over to Andrea, and I'm just going to cough because I need to clear my throat.
Thanks so much, Jacqueline. Hopefully that's coming up for people seeing my screen now. It looks the same as Jackie's. Yes, I'll just reinforce what Jacqueline was saying there. MS Connect's a great source of information and advice and support. We would encourage you to call them anytime. What I would say is, please leave a message. If you can't actually get through to talk to someone, there's 5 in that team, but if you can't get onto someone, please leave a message, even if it's as specific as what time you would like them to call you back. If you're at work and so it doesn't work, you know, you've made a call because you're on your lunch break, please let them know that you want a particular call either before work, after work, lunchtime. The phones are there, the team are there from I think it's 8 AM to 6 PM. So please leave a message. They do get back to you. They just can be quite busy. The other thing I'd also encourage you to consider, if you haven't already, is peer support. We have a fabulous team. These are our peer support coordinators, Katarina, Kim and Ange, and we've got a fabulous team of people living with MS who are trained peers. So they're not an advice service per se, but they're a chance for you to talk to someone else who's living the same life. So please make use of that service, whether it's one-to-one phone support or whether it's connecting to a group. We have some groups that are specifically for people who are working. So, you know, the level of support that you can give each other is just fantastic. And at the moment, most of the groups are running by telephone, so it's still ongoing. It's fantastic. There's a few tools online as well. So Get Your Act Together is an online tool that you can get some advice and strategies around managing various MS symptoms. Have a look for that on the website. And then just a couple of plugs that we are a registered NDIS provider, and we can also actually help you connect to that and navigate that system as well. Jackie mentioned the engagement team. We have an engagement team and we have support coordinators. So that's been, you know, a great service and hopefully really supportive to you guys. So I'll just check if there's any other questions in here. Erin and actually Sonia as well asked about the information for next week's session. No, I think it's not out yet because we only just confirmed that yesterday, and that email will come out very shortly. If you get to next Wednesday and you haven't found the information, please email education@ms.org.au and we'll make sure you get that, but that will be promoted very, very soon. Let me just have a little look here. And yes, Angela, there will be, this program has been recorded. Now, that's a very good question about whether we email out a copy of that. Someone else might be able to clarify that for me. If you register for a program and you don't get to it, you do get the recording emailed to you. I'm not 100% sure whether everybody that attends also gets that emailed, but it will be available on the website very shortly. So yes, you'll be able to access it and check it out again. Thank you, Jacqueline, for your time tonight. That's been really helpful and lots of great information. We provide this program and the type of support for people working with and living with MS all the time, but at the moment there's just so many more elements to it because we're having to work from home. So it's great that we've been able to think about how to maintain our own wellness while we're working from home, and even the practical tips about making sure you've got a good setup at home. So I hope you've been able to jot down lots of notes and things that you're going to do differently because of tonight's session, even if it's things that you're going to follow up. That would be great. Actually, Melanie's made a comment about not being able to see the neurologist and during this time as well. There's all sorts of changes. It's making life really complicated. Yeah. So it's time now to head off and have a bit of a relax and a break. So thank you all again for joining us, and thank you again to Jackie for joining us tonight. We look forward to seeing you at another webinar. Thank you.